So, how should you decide whether surgery is for you and the timing of that surgery? It's very personal and it's multifactorial. So, I often say to patients, look, the equation is quite complicated. Lots of people have bunions, and lots of people probably know somebody who's had bunion surgery. But equally, there are a lot of people that go through life never having a bunion operation. Bunions do tend to get worse with time, but worse to look at, not necessarily worse with symptoms. I think it is fair to say that if I see somebody to advise them because they've got pain from their bunion, I'm pretty certain that pain's not going to resolve on its own. And most of those patients probably come back at some point and proceed with surgery. The trouble is, as I've discussed, we can't yet avoid some inconvenience, in fact, quite a bit of inconvenience still, even with minimally invasive techniques, and there's still a certain amount of risk. So having a bunion in itself and not liking the look of it is not enough of a reason to go ahead with surgery. It really needs to be intrusive in terms of painful symptoms, so very limiting in terms of your choice of footwear, and perhaps causing symptoms even in those more careful choices. So patients will often say, well, I've got pain now when I'm walking for long periods or if I'm exercising, as well as being limited in terms of their choice. So the decision is personal and it is balanced against, as I've discussed, the risks of surgery and the rehabilitation. And despite our best efforts as yet, there's still some significant compromises in terms of your activity level for a good few weeks, if not a few months, after this type of surgery. And I've described that in a separate video. So it's risks, rehabilitation, and inconvenience on one side, work, home, family, and on the other side, the benefits of treating those painful and nuisance symptoms and limitations in footwear.